Hi, my name is Randall Leonard. I'm a staff therapist here at the LGBT Health Resource Center. And I just wanted to take a quick moment and discuss this concept of anxiety. Many people have been coming in and saying that they're feeling a lot of anxiety right now. And as a therapist, I like to sit with everybody and just give a quick explanation on what anxiety is. Anxiety is often called and referred to as fear of the future. It is there in many ways to try and protect us, and sometimes it can make us feel agitated, and it can activate our central nervous system. It really wants to just make things safe. Our brains are always focused on safety. And once you start to feel a little anxious, you start to really focus on the thing that is making you anxious. And right now, in our current culture, that anxiety is being caused by COVID-19. So what we often say in sessions is to remember to breathe. And the whole idea about breathing, especially the deep belly breath, in for a few seconds and hold, and release, is that it directly affects your central nervous system and causes you to just relax just a little bit in order to get a clearer picture to focus on everything. So the whole idea about anxiety is that if you're being chased by a lion, the whole thing is just to kind of focus on that which is chasing you. When you breathe, it slows things down so you can focus on everything that's going on, which is the other reason why we say to focus on present moment awareness and just naming things around the room that you can see. Now, sometimes when I'm telling this to clients, they may get a little bit, and I know maybe you've heard, just breathe before. And therapists, we say just breathe, and sometimes that gets a little bit of an anger response from people, just like, okay, so yeah, I keep hearing just breathe. Your emotions are also there to try and protect you, and your emotions want to pull you back into focusing on that thing that you are anxious about. So sometimes when you just start to breathe, you may be able to do it just for a little bit and then get a little bit agitated about it, but that's okay. It's just about starting in that moment and just taking it step by step by step, and knowing that over time, especially because, considering that COVID-19 is a respiratory condition, taking those deep breaths and focusing on what is happening in the moment is extremely important. And as a transgender person too, and as a member of the LGBT community, one of the things that I know as well is this concept that we have pride. It's all about what are we looking to the future. It's all about, knowing that we will make it through all of these things. So as a trans person, I also want to, and as a gender confirmation therapist, I also just want to talk for a moment about individuals who have recently had either chest masculinization or breast augmentation or top surgery or any type of gender confirmation surgery. And that is taking this time to really focus on that concept of social distancing and staying in with your support network while you're healing through this process. It is extremely important, especially because of how COVID-19 affects the body. And also, we had posted this online about binders. If you're wearing a binder or if you're wearing a corset, be extremely careful about that too, because of, again, those respiratory concerns. So the biggest thing to focus on, the biggest takeaway from all of this is to, yes, you've heard it before, but to focus on that breathing. To focus on present moment awareness, to also connect with individuals. We have technology now to be able to connect with people in your support network. And also remembering places like the LGBT Health Resource Center, we are, here to be able to assist, reaching out to us via social media, reaching out to us, via phone. We are definitely here to be able to support, and we will get through this. So thank you so much for listening to me on this, and thank you. I appreciate it.